Good evening. Let me share my screen for our week 11. So we will be discussing about validity because it is expected that you are now in the process of gaining or looking for the approval of the internal institutional review board, I should say, or the ERB, right, or the ethics review board. So whether you are developing a research study or reading a report or contemplating the use of research findings, the challenge is to determine whether the intervention or manipulation of the variables causes the desired outcome or result. As what I told you before, internal validity is the confidence that an experimental treatment or condition made a difference and that rival explanations were systematically ruled out through the study design and control. Okay. In here, the researcher should be very confident that the treatment is valid and everything is ruled out properly. Actually, in internal validity, it is about the strength of the design and that um, the controls were placed on the experimental situation. So that is what we call as the internal validity. As what I've been telling you before, it is a must for you to have the congruency of your design, of your SOP, and of your title, of course. Okay. In contrast, external validity refers to how generalizable the results are and to whom external validity is also about the applicability and usefulness of the findings. So, for example, we might want to know if a particular exercise and diet program results in significant weight loss. Okay? And that no other reasons account for weight loss except the exercise or the diet program. This is an example of internal validity. So if the findings of this research are credible and trustworthy, we will also want to know the results, if the results could be generalizable, okay, or to or or it has the ability to be transferred to a larger population. So this is, of course, an example of external validity. Okay. Next is we have here the classic Hills criteria for causality. Okay. So we have here number one, the strength or the effect size. While a small change does not mean there is no causality, a big change is more likely to be causal. So that is what we call the strength or the effect size of a research. Okay. Don't forget to be used as evidence. Research need to meet all these criteria for us to be, because these are called your fundamental conditions and it should be met. Okay. Right here, consistency. Replication of findings by different researchers with different samples strengthens the likelihood of an effect. So when we say consistency or reproducibility of that research, is for you to be able to find out if there are studies done with the same topic, pero ginawa siya in another moment or um, different samples, but it has the same questionnaire and the title. So that is what we call as replication. Parang inuulit mo yung research in a different time with different participants or different samples. We have here specificity, okay? The more specific an association between an intervention and its effect, the greater the probability of its causal relationship. So there should be a better association or more association of the intervention and effect for us to be able to say or say that there is a causal relationship. We also have here what we call as temporality. In the intervention must precede the outcome, of course. Okay. And then we have the biologic gradient, greater levels of intervention, and the outcome are to be articulated or are to be forwarded. Okay. Next is we have here the plausibility. Okay. The plausibility, take note that a theoretical link between the intervention and the outcome could be articulated, but there are no plausible alternative explanations. Okay. according to Poser in our book, the book that I've been reading for the longest time, that I've been making these PowerPoint presentations for you. Okay, no other factors could be responsible for the outcomes. For example, nothing could have occurred that might have been caused the weight loss except the prescribed exercise and dietary intervention. So that was the example that we've been using a while ago. When we say coherence, consistency, okay, the word consistency between highly controlled laboratory results and those in applied settings indicate causality. So it talks about consistency. And when we say experiment, okay, documented experimental evidence as demonstrated by statistical analysis that leads to causal conclusion. So it's this is statistical analysis that gives us um that result that could really tell us that there is a causal conclusion, or that could lead us to have a causal conclusion. An analogy. So this one, if similar factors have different or have similar effects, causality is supported. Okay. Next is we have here minimizing threats to internal validity. Of course, a good research design reduces the possibility that alternative explanations for the result might exist. Okay, these alternative explanations for the outcome are often referred to as threats to internal validity, and we start with measurement or observation. Measurement or observation is one possible method to rule out threats to internal validity. This method could actually demonstrate that threat either does not occur at all or occurs so frequently that it is not a significant alternative explanation. Okay. For example, in a study designed to determine the effects of music on agitation, in some situations, of hospital patients with dementia, for example, the music did reduce the agitation. An alternative explanation for this outcome may have been the effect of visitors to the patient or on these patients. However, observation and measurement of the number and frequency of visitors could reveal that this was a rare event for this sample. So it is measurement or observation. Okay. Next is the use of an appropriate design. Most research questions can be examined using various designs. However, some designs are not appropriate for dealing with the specific requirement of a research problem. If the researcher wishes to determine whether music is effective, in our example a while ago, in reducing anxiety in patients undergoing radiation therapy with time, a repeated measure design might be effective. Okay. Sorry guys, I have a pediatric patient here. Okay. Whereas a survey might not reveal any significant um, effect of music intervention. So when we say you use the appropriate design, it should be a design that could really be or applicable to your study. Okay. So as a researcher, choosing the correct design to answer the research questions is fundamental or is necessary to control threats to both internal and external validity. We also have here the control uh, of bias. Okay, of course, in here, a good design is also dependent on the control of bias. Um, sa totoo lang, bias exists in all research. It can occur at any time in the process, in any research design, and it's difficult to eliminate, but it could be controlled. Okay, the only thing that we could do is to control the bias. Okay, and controlling the bias or for bias requires careful consideration of where bias might be expected to exert effects in the research process. Okay, it might be in the five major areas. Number one, as what I've told you, the study design. When there is incongruence between the aim of the study and the design, bias or the likelihood of bias is increased. Okay, this disconnect may be due to the researcher's personal belief or greater familiarity with particular designs. Yun lang yung alam mo. Dun ka lang familiar. So, pinili mo siya. Okay? Kahit hindi na yun yung sasagot sa tanong mo. Okay? Okay, parang pag-ibig lang yan na no choice ka, okay? Pero mali na, okay? Alam kong mali na, pero di kayang bitaw. Okay, in upper, yan. Okay, so that is an example of that. Next is, another one of the control of bias is selection and participation. This talks about the sample, on how you select the sample, assign the treatment groups, and this could introduce a sampling error to the study. Okay, data collection and measurement is another. Measurement bias can occur when assessment tools are not objective, as what we have discussed last time, valid and reliable. So um, this time, interviewing, for example, for qualitative data collection could influence by bias in both question construction and the way you ask the question, your intonation, the way you look at the participant. Okay, so that could add to the data collection and a measurement bias. Another um, form of bias could be in the analysis. Okay? Of course, it is a natural instinct to look for results that support preconceived notion of effectiveness. Parang alam mo na kasi na parang yun yung kapupuntahan, okay? Selective reporting of data, okay? Yun yung ginawa mo. Pinili mo lang kung ano yung gusto mo. Could cause bias to data. And of course, those sometimes that are inaccurate. Okay, so the researcher's beliefs are discarded. So parang pinili mo lang yung gusto mo. So we have here, another is publication and dissemination. Studies are more likely to be published if they have statistically significant findings, kaya napipilitan ka na yung result mo, gawin mo siyang, ano na to, may significant finding siya. Okay? So quantitative studies could suffer from publication bias when findings are not presented clearly or in depth. So we have again, bias is introduced to research in 5 areas: study design, selection and participation, data collection and measurement, analysis, publication, and dissemination. Okay, so we have here a statistical analysis. Okay? And here, statistical analysis can report the internal validity of a study by quantifying probability of type 1 and type 2 error. Okay, for this time, the reader can then determine if the amount of error calculated for the study is acceptable or hindi, or whether the results should be used only cautiously in practice. Kasi dito, the researcher can also support validity for clinical application of a study's result by calculating the tests in the effect size. Pero ito ginagawa na ng ano to, ng statistician mo, okay? So, finally, valid conclusions are drawn when data meet the fundamental assumptions of the statistical use to analyze them or to analyze the data. Okay, so those are minimizing the threats to internal validity. So we have here determining the probability of type 1 and type 2 errors. Sorry for that. Okay. We have here the type 1 error. So before accepting results as evidence for practice, the probability that an error was made should be evaluated para alam natin if there was an error. Okay? This assessment enables the researcher to quantify the role of error into the outcome. So we have two types of error. The type 1 is also the alpha, okay, referred to as the level of significance. Okay, the researcher erroneously draws a conclusion that the intervention had an effect. Okay, so this one, we also have here type 2 error. Okay, it's i-explain ko pa sana pero it's not within the parang the level of the student to understand this one. Okay, the type 2 error, often called beta and related to the power or beta, okay, to the power of the statistical test. The researcher erroneously draws a conclusion that the intervention had no effect if there is type 2 error. Okay, actually the type 2 error is the acceptance of a false null hypothesis or the statement that there are no differences in the outcome when in fact there are differences. Okay, so that could happen. Okay, so type 1 error is generally considered more serious. Such an error will lead to the researcher to believe an intervention is effective when it is not. So mag-ingat tayo, okay? Because focusing solely on tight controls of type 1 error, however, means that significant findings may be overlooked. Okay? Sometimes the relationship of type 1 and type 2 error is paradoxical. As one is controlled, the risk of the other increases. Kaya medyo mahirap po. Both types of error should be avoided. Okay? Missing the opportunity to apply an effective treatment because of its effects could not be detected is unfortunate for patients and researchers alike. So, kailangan talaga that the best approach is to carefully consider the control of sources of bias, set the alpha level appropriately, use the effective sampling strategy, and select the solid design for the question. So this one kasi parang nahirapan kayong intindihan kasi these are done by the statistician and these things are better understood by the statisticians, and sometimes as a researcher, they will not going to explain to us what are these type of errors. But getting all these elements aligned requires a balancing the risks and benefits. And that is our task as a researcher. So we have here an example. I'm sorry, guys. You have to hear my child. Okay, she's sick. So we have here, for example, a study is designed to test the effects of hydrotherapy on anxiety during the first stage of labor. All women who present to a single birthing center are invited to participate. Women are allowed to choose whether they use hydrotherapy. So type 1 error, anxiety is reduced in the treatment group. Okay, all the women who choose hydrotherapy have a birth coach present. Is the reduction due to the hydrotherapy or pwedeng dun sa birth coach? Yun lang, type 1 error yan. Okay, kasi pwedeng hydrotherapy yung tinitingnan natin for the reduction of anxiety, and then meron pala siyang birth coach. So, ang sinasabi niya, na-reduce ba yung anxiety because of the hydrotherapy or because of the presence of the birth coach? And that is a type 1 error. For type 2 error, anxiety is not reduced in the treatment group. All the women who choose hydrotherapy had a higher level of anxiety prior to labor. Is the lack of response because of hydrotherapy does not work, or because mothers had more anxiety to begin with? So type 2 error is, yun nga, parang nagkaroon daw sila ng mas mataas na anxiety because of hydrotherapy. So tinatanong niya, dahil ba ito sa kawalan ng hydrotherapy or mas marami talaga yung anxiety ng mga nanay to begin with. Okay. With the hydrotherapy. Next tayo is the calculating and reporting tests of effect size. Okay. So effect size must be considered when evaluating, of course, the validity of the study. Okay. Effect size refers to how much impact the intervention or variable is expected to have on the outcome. So even though, of course, the experiment might yield statistically significant results, this may not translate into clinical important findings. Yun yung problema natin. Okay? Meron kasi yung mga large effect size that enhance the confidence of the findings. When a treatment exerts a dramatic effect, then the validity of the findings is not called into question. Yun lang. Minsan, in contrast kasi, pag maliit masyado yung effect size, the potential effects from extraneous variables, alam niyo na yun, di ba, is more likely to have less validity. So, yun yung problema natin, okay, for the effect size. Factors that jeopardize internal validity. We have here, for example, history or historical threats. This refer to events or circumstances that occur around the time of the introduction of the intervention, or pwedeng nag-occur siya the time during data collection. So, pwede kasing yung event na yun, it could be unpredictable din. It could be expected na this could exert an effect on the subjects and as a result to the study conclusions. Okay? Another one is maturation. When you say maturation, it is called as your maturation effects. This is a threat to internal validity because the changes that occur in subjects do not happen as a result of the intervention, but rather because of the time passed. I'm sorry, there is a mosquito. Okay, sorry. Anak, kaya mo? Kaya? Okay. I'm asking my 4 years old if she wanted to go to the hospital. Sama ng ubo niya, guys. Okay. Maturation, of course, in research study is related to changes that occur in subjects over time but are not a result of the intervention or attribute being studied. Okay. Subjects, of course, can change for a variety of reasons, such as normal aging, physical growth, acquisition of knowledge and skills, or a study outside the variables or physical changes related to the disease process. For example, if you're studying the effects of relaxation techniques on management of pain in patients with bone metastasis, of course, okay, masakit yun. The effects of techniques will be less effective as the disease worsens. So yung tinatawag nating maturation. So much reason para maintindihan natin in particular concern if, for example, we're talking about the population are expected to change over time in longitudinal studies. So, yun yung sinasabi natin kanina. Okay. For example, if you're including children or older adults for examining diseases. So, we have here testing or testing effects. If the threat or the threat of testing is related to, of course, the effects of taking test or a test and then retesting the subject, yun, pwede kasi inulit mo lang. Subjects can become more proficient at test taking and repeated or on repeated experiences, pinaulit mo nga naman, di ba? So, medyo na-master na niya. Okay? For example, the effects of different types of educational methods on the retention and skills. Okay? That is, of course, sometimes necessary to manage central lines. Pwede sa ICU, ganyan. Siyempre, pag pinaulit mo, mas madali na lang. So, that is testing. Another is instrumentation. Okay? So, instrumentation effects may occur because the instrument or data collection device has changed in some way. Pwede kasing threat ito pag nagko-collect ka ng multiple, pag nagko-collect ka ng data to multiple individuals in a study, for example, na inuulit-ulit mo ginagamit, okay, yung instrument na yun, tapos marami nang gumagamit. So, medyo nag-change na. So, instrumentation-related threats could be reduced by training the observers, training the observers to observe carefully using very specific protocols and testing inter-rater reliability para makita natin if yung instrument na yon is nagamit siya ng maayos. Okay? Consent. Sometimes kasi those subjects who consent to participate in the study may be different from those who do not consent in systematic ways. Of course, medyo pwede kasi na napilitan lang. Okay? The differences between participants and non-participants, we call them non-participants because they have not consented, have been measured in multiple clinical trials and reported to have systematic or effect to the data. So, kailangan natin na i-consent yung mga participants natin or respondents natin. So, we have here treatment effects. Subjects may, of course, possibly react to treatment itself even if it does not exert an effort or it does not exert a therapeutic effect. This kind of treatment effect or the treatment itself may elicit a response that cannot be differentiated from physiologic response. And this threat to internal validity is primary, or it is the primary reason for the use of randomly assigned control groups and comparison groups. Kasi sometimes, subjects in a study may perform differently because they know that they are in the study. Pwedeng ganun kasi. In such case, pwedeng magbago yung mga subject not because of the intervention but rather because the subjects have behaved differently than they would normally. Okay? Yung tinatawag natin, this is phenomenon is what we call as the Hawthorne effect. Ano na nga ba yung Hawthorne effect? Okay. The Hawthorne effect has been documented extensively, yet little is known about the conditions where it occurs. Okay. So, yun yung example natin. So, tandaan natin that the Hawthorne effect is of greater concern if the researcher is in a position of perceived authority. Okay? As in classroom studies, when physicians lead the research teams, pwede kasi natakot lang sila, di ba? Okay. So we have here multiple treatment effects. When multiple treatment are applied at the same time, it is difficult to determine how well each of the treatment works individually. Perhaps it is a combination of treatments that is effective. So another concern is the effect of the order in which the treatment or intervention are administered. Pwedeng ganon. It is concerned about the sequence of events, sometimes particularly is worrisome, okay? In all interventional studies, okay? Na kung saan kailangan natin ng confirmation of the independent variable that precedes the dependent variable. So yun yung example niya. Pwede kasing i-threaten ng multiple treatments yung validity because they make it impossible to determine the unique contribution of the treatment to the outcome of research. Okay, so talagang kailangan pag researcher ka, very sensitive ka sa mga changes. So we have here number 8, subject selection. It refers to the biases that may result in the selection or assignment of subjects to groups in a way that is not objective or equitable. Okay, selection effects could be exerted by the researcher through the sampling strategy or pwedeng by subjects during recruitment period. Okay. Meron din tayong ay pwede kasi na selection bias, pwede kasing the more specialized the population under the study, pwede kasing mas difficult yung pag-recruit ng representative ng subjects. Okay? Attrition. Okay? Number 9 is attrition. It refers to the loss of subjects during the study. Okay? Iniwan ka na. Hindi lang pala yung love life mo. Okay? Pati yung mga respondents and participants mo. So, for example, longitudinal study nga naman yan. Diba? Very long time. Tapos iniwan ka yung 44, nag-start ka ng 44, tapos, nag-start ka ng 100, tapos naiwan na lang 44, okay, or wala nang naiwan. So, some attrition is expected in any study, hindi naman talaga, ano yan, di ba? This type of risk becomes a concern when validity of the result is, of course, affected. Kaya paano? Kaya mo? Okay. An analysis and discussion of this one is very important. For example, attrition could be avoided by ano bang mga pwede natin gawin to uh, avoid risk of attrition. Number one, advising the subjects of the time commitment in advance. Sabihin sa kanila how long it will take for them to participate in the study. Screening the participants who might be likely to drop out. So, tingnan natin yung mga walang computer, yung mga hindi marunong gumamit ng cellphone if you needed the internet or the phone to respond in your study, or making it convenient to continue participating. You have to make them feel that they are convenient in their participation to your study, and of course making or using technology supported visit reminders, how to use the internet, how to use the cell phone, how to use the computer, and providing upfront scheduling, or ano na yun, pag sinabi kasi nating upfront scheduling is nagawa na yung schedule, okay? You have to tell them when to participate and or what are their schedules in their participation to your study. Okay. Factors that, of course, jeopardize external validity. So, yung sinabi natin kanina, external validity refers to the generalizability of the findings of the research to other settings or populations. Okay? The researcher should ask, of course, ano sa tatanungin mo doon, can these findings be applied to other people or places? So, what we call it population validity. Ito yung na-generalize natin yung ano yung findings sa ibang population. For example, magagamit mo yung characteristic ng or gano'n lang, generalizability is magagamit mo yung study sa ibang population. So, number one, we have here the selection of effects, okay, or selection effects, sorry. As could be surmised, the selection of subjects is the process that will most strongly influence external validity. This time, external validity is enhanced when subjects represent the population closely, of course, and so using strong sampling strategy could enhance external validity. Yun yung okay, I'm sorry guys, I needed to give her water. Okay. So we have here the selection effects as what I've told you. This one, sometimes very impossible din kasi to gain an access to a broad representation of the entire population. Kailangan lang talaga yung strong sampling strategy natin dito. So we have here time and historical effects. So researchers should be cautious about transferring results obtained during one time period to a different time period. So pwedeng the conditions for the two time periods could be quite different. Pwedeng ganun kasi. So this one could jeopardize external validity. For example, we have here novelty effect. Okay? It is possible for subjects to react to something simply because sometimes it's unique or new. Pwedeng ganon. Okay? The treatment or intervention does not cause a change in such a case, but the subjects respond to the novelty effect. Parang, ano lang, nag-respond lang talaga sila. Okay? Dapat try ka ng ubo niya. Number 4, experimenter effect. Anak, ayusin mo yung yung paghiga mo. Okay. So the experimenter effect It is also possible for subjects to react to the experimenter or researcher, such as, for example, the results could be very different to another individual na pwedeng nag-conduct na ng study. So, magre-react lang talaga doon sa, it could, this could pose to external, threat to external validity because of the intervention may only be effective when it is applied to a particular kind of individual. Okay. Strategies to promote validity, of course, in qualitative research. Okay. Just as threats to validity must be considered and managed in quantitative design, factors that might jeopardize the credibility of qualitative studies should also be recognized and addressed. Okay. Okay, guys. Ayan, so I'm so sorry for that. We have number one, prolonged or varied field experience. Whenever possible, qualitative researchers should collect data over an extended period to allow the researcher to get an accurate picture of the phenomenon being studied. For example, the study examining work environment in a critical care unit. Okay, it should account for the fact that the atmosphere may vary from day to day, and of course, a 24-hour period, medyo mahaba lang yan. Okay? Interviews to understand the experiences of working in critical care unit may have different times, napapagod sila eh. Okay? But here, use of verbatim accounts and triangulation. So, qualitative researchers should keep accurate field notes and report results as direct quotes to avoid making inferences. The description should be, of course, close as possible to the participants' accounts, and this fidelity in reporting ensures that the meaning is captured in is the respondents, not the researchers' interpretation of it. So we can use triangulation. Okay. This one, another one is participant feedback. Okay, participant feedback, the procedure for obtaining participant feedback. Yun yung tinatawag nating member checking. Kung sinabi nating member checking, a method of ensuring validity by having participants review and comment on the accuracy of transcripts, of interpretations or conclusions, while bracketing is a method of limiting the effects of researcher bias and setting them aside, yung sinasabi natin, and demonstrating awareness of potential suppositions of the researcher. Another is we have here audit trail. Okay, so when we say the audit trail, this will allow the researcher to describe the procedures and defend the results. So documentation in qualitative research includes field notes and reports and interpretations and thorough descriptions and reports of feedback, and careful records must be kept of each of those sources of information. In addition, this one is will aid in the replication of the research with other populations. Okay. So common threats to validity associated to control, it could be number one, history. Okay. Common threats to internal validity and associated control, it could be history, events occurred during the study to have an influence on the outcome of the study, yun na. Okay. So what will you do to control it? Random sampling. Pwede yun. Maturation, dahil sa time. Okay. So ang gagawin nila dito sa mga statistician, they will have to use ANCOVA to measure effects of time. And treatment effects, subject reactions are due to the effect of being observed. And what will you do is subject binding and use of sham procedures, or what we call as placebos. Okay. I'm sorry guys, I have to make it faster. I needed to buy budesonide. And instrumentation, influence on the outcome from the measurement itself, not the intervention. So what will you do? You have to calibrate the instrument, document the reliability, analyze the inter-rater reliability, as we have mentioned last time. Attrition, subject attrition, dropouts, loss of contact. You have to project expected attrition and oversample. So carefully screen subjects prior to recruitment, and then create a thorough consent procedure so subjects are aware of what will be expected from them. So bias is the study is influenced by preconceived notions of researchers or reactions of the subject. So blinding, of the researcher, data collectors, and subjects as to who is getting the experimental treatment. Okay, I have to end it now, guys. I'm sorry, my child is sick. Thank you for today in this ends our discussion.